the blame on the genes. Oh, I have it, my family has it, or somebody else has it. It does not mean that your child should also have it. Or in fact, most of the time, child has the problem, but none of even the extended family has the problem. So it cannot be just called that as a genetic problem. And sometimes we end up running with some test, and then this non-conclusive genetic test, but we still end up saying, okay, because of genetics. No. Second, very, very important aspect to understand that it is not just some behavioral problem in the child. The child is biting, pinching, hitting, self-biting, self-hitting, spitting, rolling on the bed, anxiety, crying, laughing without a reason, etc., etc. List is very long. That this is some level of a behavioral problem, and we can fix it through behavioral therapy. It's not like that. It is not just only a behavioral problem. There's a pathology leading to the behavior. The problem that child is exhibiting, there is a underlying pathology in the body. That is what we have to understand. That is why sometimes you try as hard as you can to correct the behavior. It is not going anywhere simply because there's something deep inside the body which is exhibiting, which is stemming from that problem as a behavior. So unless we go deeper, find out what is the problem, and we fix the problem, this problem is not going anywhere. It can subside for some time, it comes back, it comes back, it comes back. Right? So definition itself is incomplete. That this is some behavioral problem. There's so much more happening beyond behavior in our children. Okay. Now, beyond this behavioral issues, if we look at them, they have skin problems, they have breathing difficulties sometimes, they have asthma sometimes they are scratching their penis and vaginas, sometimes they have inner itching, sometimes they have adenoids, sometimes they have tonsillitis, lymph nodes are enlarged. Some of these children have excess eating of the food, some of them they don't eat at all, very, very picky eaters. So it just not only a brain which is only involved. If you look at it, almost all systems of the body, they frequently get sick, they get fever, they get tired, their muscle tone is weak. So it's just not only behavior problem, not just only problem in the brain, but it's a problem in the whole body. So it's a multi-system disorder, not just in the brain, not just a behavior, not genetics. It's important as a parent, because when you're trying to do any therapy, any kind of therapy, doesn't matter what you're trying to do, don't try to only understand the solution. First, understand the problem. Then we will see what solutioning we can do to fix the problem. If we don't know the problem, sometime it can fit into the solution, solution can fit into it, sometime it might not fit. So as a parent, you need to understand the problem better. So it's not just a genetic problem, not just a behavioral problem, not just a brain problem. It's a multi-system disorder. Okay. And most of the behaviors, most of the lack of skill in child is because there is something wrong in their body. And we have to fix that to take the child out of the